Hello, everyone. Good morning, good evening, or from whichever part of the world you are. I'm Megha. I'm a yoga therapist based in Singapore, and I'll be the moderator for this session today. So welcome everyone, all the Zoom audience, all the Facebook Live audience, anybody who is watching the session, welcome everyone, a warm welcome to this International Conference of Integrative Medicine. Organized by Union Yoga Ayurveda Singapore. So now I'll be introducing the speaker. We have a very special guest with us today, Dr. Bir Khalsa. He is a PhD Assistant Professor of Medicine, Harvard Medical School, USA. Dr. Khalsa has been fully engaged in biomedical research on efficiency of yoga and meditation practice for improving physical and psychological health since 2011. He has been practicing yoga as a lifestyle since 1972, and he's a certified instructor of Kundalini Yoga. He's also Director of Yoga Research for Yoga Alliance, Director of Research for Kundalini Research Institute, a research institute at Benson Henry Institute for Mind-Body Medicine, and research affiliate for OSHA Center of Integrative Medicine, and Assistant Professor of Medicine at Harvard Medical School. Dr. Khalsa has participated in various studies related to mind and body and has published more than 30 papers on this topic. His papers often talk about insomnia, post-traumatic stress disorder, chronic stress, anxiety, depression, which are pressing issues these days, often this fast-paced world, often ignored or neglected. So Dr. Khalsa has also works with International Association of Yoga Therapists to promote research on yoga and yoga therapy as a chair of scientific program, as a chairperson of scientific program community. So there is a lot more, but I will stop here. Over to you, Dr. Khalsa. Today's topic, I would also like to mention, he'll be discussing yoga for cancer patient, how yoga can help cancer patients through their journey, more from a scientific rationale, scientific point of view. So over to you, Mr. Khalsa. Thank you. I'm honored to invite you here.
Thank you very much. Thank you very much. And it's a pleasure to be here from the other side of the world, where it is exactly 12 hours opposite, but it is a pleasure to be here. What I want to share with you is the science behind yoga, how yoga, give you a sense of the research that we have and the concept that we have about how yoga works. And from there, that provides us with a scientific rationale of how yoga can be helpful for disease states. So I'm going to go ahead and start sharing. And so the topic is yoga for cancer patients, a scientific rationale. And I will also be doing a very broad review of the research evidence of the studies that have been done on yoga for cancer patients, which is growing rather dramatically, as you'll see. Now, I'm not a cancer researcher myself, but I am familiar with the field of yoga research fairly intimately. So I hope to share what we know about how yoga can be beneficial for cancer patients. So let's start talking about physiology. And we have growing evidence in this field. We have starting before published in scientific research. One of the cases not too long ago called the practice of yoga in healthcare. And I was joined by leaders in research, including who is a cancer researcher who's posting as well. And in chapter 4, so we actually summarized the research on psychophysiology of yoga. Now, I want to just give you a sense of some of the basic concepts. One of the concepts comes from studies that have been done on back in the 50s. And a lot of studies were conducted in which people have studied yoga masters. to see what changes they were going through and what experiences they were having. This particular study was done over the course of an entire year, where these researchers traveled all over India with this portable recording equipment, hooking up these yoga masters and trying to understand what was going on physiologically with them. And the major conclusion from this extensive study was that physiologically, yogic meditation represents deep relaxation of the autonomic nervous system. Now, the autonomic nervous system is one of the key players in what we call the stress system. It's the system that mediates our emotion response and our stress response. And it was called the autonomic nervous system originally because it was believed to be automatic. In other words, that you had no control over the autonomic nervous system. And so here is this research showing that these yogis could control the autonomic nervous system. And that introduces a central construct, a central idea in the entire field of what we call mind-body medicine, and certainly in the field of yoga research. And that's the construct of self-regulation. The idea that through these training of these yogic practices, you could control internal state, both your physical, emotional, as well as mental state. Now, this is a very important concept because in modern medicine, this concept is not very popular and it's not very well known. It's really only well known in the field of mind-body medicine. This is important because it tells us that patients have the possibility of changing their internal functioning. And that can have significance for day-to-day living, for prevention of disease, and in some cases, as we can see, actually in the actual treatment of disease. So this is a logic model that really summarizes the sort of the results of all of the research that's gone on so far. And when we talk about yoga, what we should really be talking about is not just the postures and exercises, which yoga is most known for, but traditional yoga really incorporates the breathing techniques, or the pranayama, the deep relaxation practices, and very importantly, the meditative component. And so this is what historically and traditionally yoga has been, and this is what scientists really have been studying. They have not just been studying postures, they've been studying traditional yoga in this full breadth. And actually an argument could be made that meditation is perhaps the most important component of yoga practice, and that the physical components are really there to support the meditative component, even though these physical components have benefits and improvements on their own. Now, through all of these four different types of practices that are involved in typical yoga practice, they all contribute to the physical level. They make changes in the physical body. And I'm calling this in this box, I'm calling this improvements in fitness. And that includes things like improvements in flexibility, muscular strength, coordination and balance, respiratory function, particularly through the breathing techniques. And that leads to a sort of a self-efficacy, the ability to have more control over your internal body, your physical functioning. And that actually has impact on your psychology through the mind-body connection, because what goes on in the body is actually reflected in the mind. Now, also through all four of these practices, we are improving this construct of self-regulation. And the place that that is most dominant is in the regulation of stress and the regulation of emotion. And this is very powerful because most people in modern society, we don't learn the ability to regulate stress and emotion. And yet these yogic practices are ideal for doing that. And there's a good deal of research that shows how effective yoga can be for stress and emotion regulation. And with practice over time, this leads to these behavioral states of resilience to stress, the ability to rebound from stress, to tolerate stress, and equanimity in the face of the ups and downs of emotions, to be able to tolerate and manage your emotions more effectively. And of course, this leads to an overall psychological self-efficacy. Now, in terms of another component here, it's primarily the meditative component, the focus of attention. Meditation, most simply described, is the relaxed, non-analytical focus of attention. And different forms of meditation differ in respect to what the focus of attention is on. So typically in single point focus, or so-called concentrated meditation, which is more common in yoga practices, the focus is on a mantra, or on the focus on the breath, or focus on a candle. Whereas in Buddhist type meditation, the Vipassana, the focus is on the flow of sensation or the flow of thought. But in either case, you are focusing attention. You're engaging the attention networks of the brain to focus. And that quiets mind wandering down. And with time, that improves a number of psychological characteristics. And one of the most important characteristics is what I'm calling awareness, specifically mind-body awareness, the awareness of what's going on, a sensitivity to your own physical and emotional and mental state. And this comes through the engagement of the attention networks. You improve your ability to attend because you're practicing attention in meditation. And another term for mind-body awareness that's become very popular internationally is mindfulness. And yoga definitely increases mindfulness. We have a number of studies demonstrating that that's the case. Because you're improving these cognitive functionings, you're seeing improvements in cognition and things like concentration. And over time, as you practice these techniques and develop a relationship with your own thought processes, we move into what we call metacognition, the realization that we are not our thoughts, that we have thoughts, that we have thought processes, but that through these meditative practices, we can exert some degree of self-regulation over these thought processes. And that is very powerful and leads to a good deal of emotion and stress regulation itself. And then the final thing I want to mention that also primarily would come from the meditative component is that over time, many people experience deeper states. And I'm calling this what we would say is spirituality. During meditation practices, or even during the yoga practice itself, people will experience these sort of deep and profound unitive states. These are states of transcendence, or the state of flow, the sense of being in a sense of flow in action. That can lead many people to a sort of a deeper transformation over time, and actually a change in life meaning and purpose in a very positive direction. In fact, many people who have practiced yoga over the long term will say things like, yoga changed my life. It will change people's perspectives and their view on the world. So one thing you can see from this logic model is that we're changing human functioning from the very gross level of connective tissue and muscle to the deepest experiences that humans can have and everything in between. The other thing is that this is a very new way to talk about yoga. It gives us a new language about the science of yoga. We have very strong evidence on the fitness level because these kinds of changes are very, very objective and can be measured very easily. And modern science is looking very nicely at self-regulation and awareness. We have things like neuroimaging, molecular biology, biochemical research that can examine these changes. And the bulk of research has really been in these two areas here, which are very, very powerful aspects of the benefits of yoga. And we have much less research on the spirituality. Now, because we're making these changes across a broad spectrum, we're seeing changes in what we would call global human functionality. And this goes from the gross level of physical and mental health and performance to the deeper skills of stress and emotion regulation, awareness and mindfulness, and ultimately this state of metacognition. And metacognition is really what Patanjali's Yoga Sutras were all about, is this idea of thought regulation. And that ultimately over time can lead to these deeper, more contemplative states. Improving positive behaviors, a sense of well-being, improving values, an improvement in life purpose and meaning, and what I'm calling pure spirituality. Now, from this logic model, you can immediately extrapolate to practical circumstances, whether that's yoga in children, whether it's yoga in the elderly, or whether it's yoga in medicine, and whether it's yoga in cancer patients. So as we'll talk about, stress is a big factor in cancer patients. Sleep is a big factor in cancer patients, and stress is a big player in terms of regulating sleep. Awareness can change behavior because people become more sensitive to their bodies and change their behavior as a consequence. We know about the physical benefits of exercise and how that can be very important. And then, of course, cancer can be a life-threatening disease. So this whole idea of coming to a deeper sense of life meaning and purpose can be extremely valuable in a cancer setting. So now let's turn our attention more specifically to yoga for cancer. What is the evidence that this is the case, and what are we looking at? Well, one question that many people often ask is, from a very gross level, well, can yoga cure cancer? If I practice yoga, can I cure my cancer? And I think that's a very dangerous question to answer in the affirmative. I don't think that you can say that, and it would be unethical to actually claim that. And so this quote here is actually from a paper by one of the speakers in the conference, Dr. Rao. It is currently not established as a cure for cancer, nor as a definitive way of preventing it. So that's very important. You can't say that yoga can cure cancer. However, and this is a very important proviso, yoga can increase physical, spiritual, and emotional wellness, which many cancer patients might require. And I would go even further that many patients absolutely do require this, because cancer patients are undergoing a good deal of stress and symptoms. And that is summarized in this page here. So what we're really looking at when we're talking about yoga research for cancer patients, we're talking about looking at these so-called comorbidities and symptoms. And these come in two categories. One is from the cancer itself, from the cancer diagnosis and the consequences of that. And the other one is actually from the treatment and recovery and side effects from the treatments of cancer, from the chemotherapy, from the surgery, and from the radiotherapy. So all of these have a variety of symptoms. So just getting a diagnosis of cancer, of course, this is a life-threatening disease that can cause enormous amounts of stress, anxiety, and depression, and it does in many cancer patients. That is also associated with a sleep disturbance. And sleep disturbance is a problem because sleep disturbance impairs immune function, which is already being impaired by the stress. And of course, that leads to a decline in well-being, a reduction in quality of life, and even a challenge to patients' life purpose and meaning. So these are very important symptoms to treat, and this is one of the major areas of research of yoga for cancer patients. But there's also a significant amount of research on these side effects that come from the treatments of cancer, the pain that can come from surgery, recovery of surgery. Fatigue is a very, very common side effect. Nausea from the chemotherapy. A lot of patients also experience what we call chemo brain, or the cognitive decline in functioning. Insomnia is also a problem. There's also lymphedema and swelling, often from the surgery, musculoskeletal issues, and a number of other issues. So this is what the research on yoga for cancer patients has really been looking at. And what I'm going to do now is sort of share with you from a broad perspective to look at some of the review papers that have summarized the research, because this is really what we can really talk about. So we have in our textbook, The Principles and Practice of Yoga in Healthcare. We actually, when we were putting this book together, we actually devoted 2 chapters to yoga for cancer patients because of the extensive amount of research that's been done in this area. So this textbook is available. It's written mostly for scientists, but it can be read by the general public. We have, this is an edited medical textbook, so we had many experts in the field, including the cancer research experts that contributed these chapters. So these 2 chapters are chapter 16 and 17 in the book. We devoted one chapter to the research on yoga therapy during cancer treatment, and one chapter to the yoga research looking at yoga therapy for cancer survivors. Now, just looking at some of the review papers, before what they summarize and some of the basic findings that we see in the literature are summarized in these bullet points. It is, as I just mentioned, a very rapidly growing field of yoga research, and that is because cancer patients don't have many other options. There are no drugs for stress. And you don't want to have cancer patients taking more drugs than they're already taking. So yoga is actually a very good fit for a lot of these symptoms that modern medicine can't address very well. We have very multiple reviews and meta-analyses now that are published, which really summarizes the research on yoga for cancer. One of these reviews reported, and this was in 2016, that there were 138 clinical trials in over 10,000 patients. So this field is substantial in terms of its relevance to yoga research as a whole. Most of the yoga research has been done on breast cancer patients and much less on other forms of cancer, including colorectal, leukemia, lymphoma, lung, and prostate cancer. Now, the interventions that have been used in most of these studies are very mild and gentle yoga forms, restorative yoga, or what is commonly known as chair yoga, very simple postures and breathing practices and meditation. Most of these have been applied in group settings, in group classes, and they are all tailored to the patient's needs and limitations. Of course, if you've had surgery, you have very limited range of motion and you can't do a lot of intensive exercise. So these practices are really tailored to the patient's limitations. Often, as the research is most rigorously done, you have a regimented treatment protocol, so everyone gets the same treatment. And these are practiced regularly over perhaps 1 to 3 classes per week, depending upon the type of research. But many studies also include a regular brief home practice. So patients might be asked to practice 20 minutes or 15 minutes per day. And typically the treatment ranges have been anywhere from 4 to 24 weeks long to see benefit in these symptoms. So this is a global review that's been published very recently. This is 2019. Lorenzo Cohen is one of the authors. He's a member of this symposium. And what they looked at in this review was randomized controlled trials of yoga. The randomized controlled trials are the most rigorous types of research trials. 13 of these were conducted during treatment, 12 after the cancer treatment, and 4 with mixed samples. And what they concluded was that findings both during and after cancer treatment demonstrated the efficacy of yoga to improve overall quality of life. Fatigue was the most commonly measured outcome, and most RCTs conducted during or after cancer treatment reported improvements in fatigue. Results also suggested that yoga can improve stress, distress during treatment, and post-treatment disturbances in sleep and cognition. And they also said that yoga may improve biomarkers of stress, inflammation, and immune function. And this is a slightly older paper, just 1 year older. And this paper was based on a total of 24 clinical trials of yoga for cancer patients, looking at low intensity forms of yoga, specifically gentle, hatha, and restorative. And these are feasible, safe, and effective for treating sleep disruption, cancer-related fatigue, cognitive impairment, psychosocial distress, and musculoskeletal symptoms in cancer patients receiving chemotherapy and radiation and cancer survivors. And the conclusion was that clinicians should consider prescribing yoga for their patients suffering from these toxicities by referring them to qualified yoga professionals. Now, there have been a number of these sort of general reviews, but there are also reviews on specific areas of cancer symptoms. So here is a review paper published in 2019, the title being Yoga Has a Solid Effect of Cancer-Related Fatigue in Patients with Breast Cancer. This was a meta-analysis. This looked at a total of 17 studies that included over 2,000 patients. Yoga had a large effect on fatigue in post-treatment breast cancer patients and had a small effect on intra-treatment patients. Yoga can be considered as an alternative therapy for relieving fatigue in breast cancer patients who have completed treatment or undergoing anti-cancer treatment. This is also a review. This was published in 2020. This is also on fatigue. This looked at 29 studies of 1,800 patients, and they concluded that yoga practice was associated with a small, statistically significant decrease in fatigue. The results suggest that yoga may be beneficial as a component of treatment for both fatigue and depression in cancer survivors. So that previous slide was in cancer patients. This review is on cancer survivors. Now, another topic is cognitive decline, the so-called chemo brain. This review paper looked at 10 articles that met the inclusion criteria, 6 randomized controlled trials, and a few other trials. 5 of these reported some positive effects on cancer-associated cognitive decline. And they concluded that yoga is one complementary therapy that may help patients resume their lifestyles prior to cancer diagnosis by improving cognitive functioning. Another area is lymphedema. This looked at 5 studies included in the systematic review. The sample size, the number of patients in these studies varied from 16 to 23 with a total of 85 participants across all studies. Compared with clinical breast cancer-related lymphedema routine care, yoga intervention could reduce disability, lymphedema, and fibrotic change of joint and muscle, increase the range of motion and mobility, and improve quality of life. Another very important characteristic is quality of life overall. And this review paper, also published in 2019, concluded that they assessed yoga-specific effects relative to any other physical exercise intervention, such as aerobics. So they were comparing yoga to an active intervention like exercise. They looked at 8 randomized controlled trials with 545 participants. And they concluded that an immediate post-intervention revealed marginally statistically and marginally practically significant differences, suggesting yoga's potentiality of greater effectiveness than these conventional physical exercises. Now, another important characteristic, as I mentioned, is sleep. And sleep is very easily disturbed, and it's certainly disturbed by cancer diagnosis, and certainly by cancer treatments. And this paper not only reviewed yoga, but it looked at other treatments that were effective, specifically cognitive behavioral therapy and mindfulness meditation. And what they concluded from this review of research was that cognitive behavioral therapy for insomnia, mindfulness, and yoga are 3 behavioral health interventions that have been recommended in the treatment of sleep disturbance in patients with cancer. Non-pharmacological approaches may be more beneficial because efficacy appears to be similar to pharmacological approaches. Patients can continue to implement behavioral strategies long after active treatment has ended, and there are fewer adverse effects. This is highlighting this point that I made, that you don't want to be giving cancer patients more drugs. They're already taking a lot of drugs. So if you can do anything that's a behavioral intervention, you are much further ahead. And then I want to highlight just 2 specific studies that bring to bear some important directions that I think that cancer research needs to go in. It's not enough just to show that yoga is effective. You also have to show that it's cost effective, that it's not more expensive than conventional therapy. And there are very, very few studies that have looked at this. This is probably the only study that I'm aware of. And this is actually an integrative medicine approach in which yoga was one component of multiple components of integrative therapies. And this was published some time ago. And what they concluded was that there was actually a significant reduction in the use of medications in this integrative approach compared to a baseline group that was using just conventional treatments for cancer patients. There was also a statistically significant improvement in anti-anxiety and anti-nausea drugs. So here you can see actually the reduction in the need for additional drugs, and that can actually be a cost savings. And what they've done is they've actually looked at the dollar savings per patient and showed that yoga is very cost effective. This is very important if we want doctors and clinics to be able to justify the inclusion of yoga in cancer centers. And then another thing I wanted to show was this idea about immune function. Of course, immune function is critical because if you have a strong immune system, you are more resistant. You are more likely to reject the tumor and your immune system can be very beneficial in this light. And we know that stress and poor sleep actually impair immune function. So this is one study, and it's actually the first author is one of the speakers in this symposium, Dr. Rao. And this is the one study they published in 2008 showing that pre and post surgery, that the natural kill cell percentage, which are immune cells, actually are higher in the yoga group than they are in the control group. So they're about the same at the pre-surgery. At the post-surgery, you can see that the yoga group here in the black has maintained their levels and are higher than conventional post-chemotherapy. So there is a benefit to yoga actually on immune function. So here is something that is actually addressing perhaps the cancer itself, the ability of patients to be able to reject the tumor by enhancing their immune function. Now, the final thing I wanted to mention was not just the sense of treatment of cancer, but I think it's very important to understand that an estimated 42% of all cancer cases and nearly 1/2 of all cancer deaths, and this is in the United States, are attributable to evaluated risk factors. This means that cancer, a large part of cancer is actually preventable due to lifestyle factors. So this is from the World Health Organization. Between 30 to 50% of all cancer cases are preventable. Prevention offers the most cost-effective long-term strategy for the control of cancer. And yoga is very valuable here because the lifestyle factors that contribute to cancer are cigarette smoking, are poor dietary control, and low levels of physical activity. And we have good evidence that yoga can improve those lifestyle factors. So this is perhaps the most important place that yoga can play a role in prevention of not only cancer, but other non-communicable diseases like type 2 diabetes, hypertension, and heart disease. So I want to also bring your attention. I am the research director for the Yoga Alliance, which is a very large organization based in the United States. It has 90,000 members. And I, as the research director, my role is so-called research literacy, to share the science with yoga teachers and with yoga practitioners so that they can understand what the science is telling us. And if you go to our site on the Yoga Alliance and go to the About Us link, that will take you to the scientific research pages. And we have curated and collected a large collection of citations. And these citations all have links, so you can go to these links and click on the links. And if you go to the link on diseases and disorders and go to the cancer page, you can see a list on the left of all the review papers, and there's links that you can read the abstracts, or in some cases, the full text of the paper. So this is a resource for yoga teachers and yoga practitioners to be able to access directly what has been published and what we know about the yoga research on cancer. I am also the director of research for the Kundalini Research Institute, which represents the style of yoga that I practice. And then I also work very closely with the International Association of Yoga Therapists based in the United States. And this is a very active organization representing yoga therapy in modern medicine. John Kepner, who is the current CEO, is one of the speakers in this symposium. This organization organizes an international conference every year, a membership conference. They accredit yoga therapy training programs, and they certify yoga therapists. And I also work with them to conduct the symposium on yoga research, which is specifically a pure scientific conference on yoga research. And the upcoming conference is in October 19th to 20th. Of course, this year it is going virtual. We are doing this via Zoom. So this is coming up in October. And if you have any interest in science, we bring together a lot of expert yoga researchers with keynote presentations, oral presentations, and then also abstract presentations. So this is a forum for you to become knowledgeable and to interact with other yoga research scientists. So thank you for your attention, and I turn it back to our moderator, and I'm happy to answer any questions.
Thank you. That was very, very informative. So now coming back to the Q&A session. I have first question coming from our chat session. So the viewer is asking that, is the breathing that helps, or it's the yogic breathing? I mean, how is it different?
So most people have a breathing pattern that is fairly shallow, and there's not much movement of the abdomen. And in yogic breathing, we practice sort of what we call belly breathing or abdominal breathing. It is a slower breath. It is also a deeper breath. And when we talk about abdominal or belly breathing, it means that the belly comes out as you begin the inhale, a little bit more than it does in your average individual. So people that practice this slow breathing technique can actually change their slow breathing pattern semi-permanently. People's breathing, actually spontaneous breathing rate, actually slows down. And what we know now from the research is that slow breathing has very powerful effects on both the body and on the mind. It has direct impact on the autonomic nervous system, on stress regulation, and also on emotion regulation. As you start to breathe slower and deeper, you are able to manage stress and emotion much more effectively. It's also a much more efficient way to breathe. So you're maintaining your oxygen level, your oxygen saturation when your body's under challenge much more effectively. So one of the secrets of mountain climbers is that when they breathe slower, when they're higher altitudes, they don't have to use supplemental oxygen as much. Another aspect of slow breathing, and it's a direct impact on the autonomic nervous system, it changes and improves heart rate variability, which is a marker of cardiovascular health and overall stress management. And there's recent research that even shows that slow breathing has direct impact on regions in the central nervous system. So these breathing practices have very powerful psychophysiological effects, and they're a very important component of yoga practice. And in cancer patients, it's very easy to do these slow breathing practices. So these are ideal for cancer patients. Now in yoga, there's also a large number of different types of pranayama practices. There's a Kapalabhati practice, which is a very fast breathing practice. There's also alternate nostril breathing practice, which takes, the idea is that you are alternating hemispheres, etc. That is the theory behind these practices, and many people find this breathing technique very relaxing as well. So these breathing techniques are very different than ordinary breathing in the general population, but they can be very effective and very helpful.
Thank you. We have one more question coming in. Suman
Hi, doctor. It's a great honor you talked about the yoga today. And I heard that you mentioned about the breast cancer, and it's a very common problem in nowadays in women's. And we can cure the breast cancers through yoga therapies and daily yoga practices. But my question is like, in nowadays, women's having a most common problem is ovarian cyst, and if they goes to the hospitals and every doctor recommend for the surgery, one surgery they do, and then after it's come one by one, then after when we visit to the doctor and they again recommend for the surgery, but surgery is not the answer to stop the ovarian cyst. So somehow my question is, can we prevent that ovarian cyst, and is there any way in yoga we can prevent the ovarian cyst treatment in our daily practices? Which kind of yoga we have to follow to stop that ovarian cyst? Because it's a very common problem in, I think it's 90% women are suffering from that. And somehow it's also means it's also from their daily routines. It's like they are not accepting that they have this kind of problems. So is there any way we can prevent?
So the first thing you mentioned was that yoga therapy can cure cancer. I would be very strong in avoiding that kind of languaging. We cannot say that yoga therapy can cure cancer. And I think that's very dangerous, and I think it's counterproductive to make those kinds of statements. So we have to be very careful in our language. Having said that, I think that there is evidence that yoga can have significant benefit for a number of reproductive problems in women. This is not my field of specialty, but there are a number of studies that have shown that yoga can have significant improvements in, for example, menstrual pain, in postmenopausal conditions. And I can't say specifically if there's research on cysts, but there is a good deal of evidence that yoga has positive benefits on reproductive aspects in women. And I think you have to look at the mechanisms. And again, I think stress is one of the mechanisms that is stress really underlies virtually every disorder. And I would be surprised if stress was not involved as a risk factor for the development of cysts. But I'm not specifically familiar with anything that looks specifically at cysts. The other thing you mentioned is that what kind of yoga, and we don't have an answer to that. All I can do is say that if you want to practice yoga, then practice a traditional form of yoga. Don't just do asanas. Don't just do postures. Do the whole practice, because the breathing techniques, the deep relaxation of the shavasana, the meditative component, all of these contribute. And all of them alone have been shown to have benefit. So you're better off practicing a style of yoga that is a traditional style of yoga, not just postures and exercises, but all of those components. And then the other thing that's important about yoga practice is regularity. You need to practice. I mean, yoga is a mind-body practice. It is a behavioral practice, which means that if you don't do it, it's not going to work. So you have to take the time and the effort to practice the yoga. And the more regularly and the longer you can practice, the more intensively you practice, the better you are, depending upon your limitations and circumstances. And typically, in terms of behavioral changes that we see in mind-body practices, we're not looking at overnight. You can't practice yoga over a week and then cure your condition. That's not the way this works. It's not like a drug. I want to cure my insomnia. I'm going to take a pill. I'm going to be better tomorrow. That's not the way that we look at mind-body medicine. In mind-body medicine, we are trying to rectify an imbalance in the mind and the body that has taken months to appear, and it's going to take months to go away. What we're doing with yoga practices is that we're restoring the body's natural functioning and normal functioning. And that takes months, that takes weeks and months. So many of the trials are months long. So if we're talking about yoga practice, we're talking about a regular practice over months on a day-to-day basis, as much as one can do and get into. So those are very important considerations when you're talking about yoga practice for any kind of condition, including cysts or for cancer.
Okay, thank you, doctor.
Thank you, Doctor. We have next question from Angela.
Yes, hi, Doctor. The question is, in my experience, it's very difficult for cancer patients with depression to meditate or to start meditating, as they easily become overwhelmed with emotion, they break down, they cry. So what is the best way to introduce that?
Well, I'm a yoga person, so I always advocate yoga. I know that mindfulness has become very popular. It's taking over the world. Everybody's talking about mindfulness. It's here, it's everywhere. I believe that it's very important to include physical practices. And the physical practices in yoga, I believe, actually improve your ability to go into meditation. And this applies to cancer patients, it applies to adolescents, it applies to children, it applies to all populations. If you can start to relax the body through the mind-body connection, the mind comes into a better state that is easier to develop, to go into meditation. And meditation, ultimately, as you practice this, allows you to cope with emotion more effectively. So as you're saying, that they are depressed, and it is difficult for depressed people to actually do any kind of activity, but it's important for them to try. That's the thing about mind-body medicine. You have to put in an effort. So there has to be some degree of effort, even though these practices can be very simple, but just getting them into their bodies, getting them to breathe slowly, getting them to sense the tension and release the tension in their body will then allow them to facilitate their meditation practice more effectively. And you need someone who is a qualified teacher who can really explain meditation, because many people have this distorted view of meditation. People will see a meditation article in the newspaper or on the news, and then they'll go into the back room and they'll say, I'm going to start to meditate. And they start to focus their attention, and then in 20 seconds, they're thinking about their job or their mother or making dinner. And then they give up and they say, oh, I can't meditate. That's it. I'm not someone who can meditate. And so there's this misconception that people that meditate go into this zone and they're perfectly holding their concentration for hours on end. They're in a trance. And this is a great misconception. Meditation is this continued pattern of focusing your attention, and then you slip into mind wandering, and then you catch yourself, and then you bring yourself back. And this cycle goes over and over and over again. So it's important to explain to patients how meditation is in real practice, that it is a lot of mind wandering involved, that there's a lot of intrusion of mind wandering. But as you continue and persist with your practice, you get better and better at holding your attention, and you find that over time you develop a skill of regulating your thought processes. You start to react less to your emotional thoughts, and you react less in terms of your stressful thoughts. And that is a sign of the improvement in resilience and equanimity that comes with these contemplative practices.
Okay, great. Thanks, Doctor. We have lots of questions coming in. So next, Juliana, would you like to unmute yourself and ask your question, please?
Hi, doctor. I would just like to ask, these cancer patients, right? Some of them, they might not be introduced with yoga in the very first place, and they might went through chemotherapy, radiology, or treatment, all these kind of treatment. And after all this treatment, they will become very weak. So what kind of yoga would be best for them? Because when they are weak, I don't think they are physically they can do the yoga. So is meditations or any kind of pranayama, it will be good for them?
So as I described, when I talked about all the yoga research that's been done, the yoga interventions that are used are very mild and gentle. They're often called, there's a style of yoga called restorative yoga. There are also a yoga practice which is called chair yoga, which is essentially sitting in a chair and doing all of the practices in a chair. And all of these practices are very mild and very gentle. It's a question of just releasing tension from the body, improving range of motion, and getting a sense of releasing physical tension. And that, I think, is very, very beneficial. So the yoga has to be tailored. It has to be adjusted to the patient populations. But movement in the physical body, all patients can do slow breathing. I mean, virtually anybody can do slow breathing. Anyone can do simple physical relaxation, the Shavasana or the Yoga Nidra. These practices can be done by anybody, and meditation can be done by anybody. So what we're really talking about is the limitation of the physical components. And that is essentially chair yoga. So you're flexing the spine, you're twisting the spine, you're stretching your arms, you may be moving your legs a little bit, you're doing some neck rolls, you're doing some shoulder shrugs. You're basically bringing yourself into your body and using that to create this mind-body connection to improve mental state and facilitate the meditative component. So all cancer patients can do something, and even the most simple chair yoga is actually fairly effective and fairly feasible.
Okay, thank you, doctor.
Thank you, doctor. We have one more question from the chat. Somebody has asked, like, what is the biggest challenge that you have faced, you know, in making people understand the benefit of yoga, not just from the fitness point of view, because nowadays it's more popular as a fitness, you know, to make them understand as a not only something physical, but something which is more holistic, something which has more therapeutic benefit. So what are the challenges that we face nowadays with this?
Well, there are two challenges, and these challenges come from the misperception of what yoga is. The most dominant one is just and only a physical exercise in posture and surface. And when people see this, that's for women, that's not for me. And patients will say, I'm a patient, I'm not healthy, I can't do that, I can't do those pretzel postures, I can't do yoga. And so this is a major, major misconception that the yoga community has to address. That yoga incorporates not just the postures, but also the breathing, the relaxation, and the meditation. And yoga can be adjusted to everyone. Flexing your spine and twisting your spine and rolling your head and shrugging your shoulders, that can be yoga too. So that's a very, very important education that we need as a yoga community to educate the public that yoga is for everyone and can be used for everyone. And that is absolutely the case. The other misconception, which is a little bit less problematic, but nevertheless very real, is the idea and if you're not a Hindu, you'll become a Hindu if you practice yoga. I mean, these are misconceptions as well. Yoga is not, in my definition, a religion. Yoga is a mind-body practice. The distinguishing feature between a religion and a mind-body practice is inspired. You can believe that yoga doesn't work. If you practice yoga, it still works. That's because yoga is biology. You are making changes, you are doing behavioral practices, you're changing the mind, you're changing the body, and you're having these benefits. So yoga is a mind-body behavioral practice. There's no belief required. Religion, on the other hand, is totally based on belief. You believe in a God, you believe in these practices, etc., etc. These are very different things. So yoga in its core is not a religious activity. That doesn't mean that people who are part of religions practice yoga. Yes, many Hindus practice yoga, but that does not mean that yoga itself is a religious activity. So those are the two major misconceptions, either the trivial one that yoga is just a form of exercise, or the other one that yoga is a religion.
I have, that's a very valid point. I have an extension to that question, so I would like to ask, like, how much do you think people are keen nowadays to understand that side of yoga as well? I mean, what has been your experience on that?
Well, it's not a question of them being keen, it's a question of them being educated. We have to be the ones that explain this to them. We have to be the ones as yoga teachers and yoga therapists that talk to the reporters and say, look, yoga is not just exercise. Yoga is not a religion. Yoga is for everyone. Look, I just taught a yoga class to a bunch of children in kindergarten, and they loved it. And then I went across the street and I taught into an elderly home, and these people were 80 and 90 years old, and they loved the yoga practice. And then I went to the cancer center and I was teaching cancer patients, and all of them were benefiting and loved the yoga practice. So it's a matter of education. It's a matter of us sort of doing publicity and doing the public affairs work that's necessary to educate the public that yoga is for everyone, and it's beneficial for virtually every type of human activity and every type of human condition. In fact, I firmly believe that yoga should be part of our school system. Yoga should be a mandatory part of our education, because we don't have anything in our education system that teaches people to cope with stress and anxiety and improve metacognition and life purpose and meaning. And yoga is that kind of a practice. It's a hygiene. It's a mind-body hygiene, just like dental hygiene. And we need to be practicing it in our schools to give the population these skills to improve and maintain health.
So you're saying that conferences like this, educating in more education in school and people sharing their personal experiences and all will help.
Absolutely. Conferences, publicity, articles in the newspaper, articles in the media, and then just teaching, just going out and teaching. And the more you teach, the more people, it becomes a grassroots movement. And it's become a very, very powerful grassroots movement. In the United States, we have statistics that show that 14% of the population is practicing yoga. That's in the US. We have similar numbers in India, but the surveys are not as specific. So a significant fraction of the population is already practicing yoga. So we need just to keep on increasing that. That is growing dramatically over the past few years. So that's a good sign. But we need also the research. I mean, the research can be very helpful. If we have research that's published, that research gets into the media. So just 2 weeks ago, we conducted a study on yoga for anxiety disorder. This was published in the Journal of the American Medical Association Psychiatry. And this had many, many media outlets looking at this. So this is one way to popularize this. We now have news articles talking about yoga being good for anxiety. So this is the way we get this practice to grow in the population.
That is amazing to know. Very nice. We have one more audience who wants to ask question. Parnella, would you like to unmute yourself? You have raised your hands.
I did.
Parnella?
Thank you. Thanks, Megha. Hi, Dr. Khalsa. It's such an honor to have this moment with you. I would like to ask you the element of fear. That is something that's very innate, because fear also is another form of, it's almost like a survival skill as well, because you want to protect yourself. How can yoga, I can't say eliminate fear, but how can it alleviate and ease the fear for anyone?
So fear is really tightly wound with anxiety. These two are very, very linked. It's the question of uncertainty of the future. And in cancer patients, it's very real and justifiable. I could die from this cancer. I could be dead in 6 months from this cancer. That is a life threat. And whenever you are threatened with life, that causes fear, that causes anxiety. Now, these are emotional responses. These are stress-related responses. And as I mentioned, we have very strong research in yoga that shows that yoga is very good at improving emotion regulation and stress regulation. And what happens when you practice yoga over time is that you become less reactive to your own fearful and anxious thoughts. That means you then go into less of an emotional negative response when you have a thought like, I might die from this. And that is a very key thing, because that can reduce the degree of emotional disturbance. And that is critical. That is a skill that you actually learn. Now, of course, there's drugs that reduce anxiety. There's anti-anxiety drugs. But this is a way to do this naturally, to develop a skill, which you then carry with you. And a large part of this skill comes from not only from the physical components, because fear is also in the body as well. Fear and anxiety are manifested in the body. Most disorders, most mental health disorders are actually mind-body disorders. They're not just mental disorders. So fear and anxiety are, to some degree, represented in the body itself. And so as you relax the body, that works through the mind-body connection to reduce that emotion regulation. And as you control your thought processes more effectively through the meditative practices, you become less reactive to those kinds of dysfunctional thoughts that are at the root of fear and anxiety, and for that matter, things like depression and other mental disorders as well.
Thank you, Doctor. I have one more follow-up question. The idea of death, what does yoga say about death?
Well, yoga's not really talk about that aspect. That's not a part of yogic literature to a large degree. In terms of life purpose and meaning, sort of a sense of who you are and what your relationship is to yourself and the rest of the world, that kind of thing, which falls more into the realm of spirituality and contemplative states, yoga can have a positive impact there. Because it can bring people to a sort of a deeper realization of who they are and their mortality, and to some degree to accept that a little bit more. And yoga can provide that sort of spiritual groundwork through these transcendental experiences, these unitive states, to understand that people are not alone. When you experience these transcendent unitive states of consciousness, you're experiencing the universe as oneness, and you are part of the whole flow of the universe. And that essentially is the opposite of loneliness, because this whole idea of I'm alone, I'm going to die, that is what's tied to this fear of death. So the more you experience this sense of oneness, this universal consciousness, which yoga, that's what the word yoga means. It means union, and it's focused at that unitive state of consciousness. The more you experience that unitive state of consciousness, the less you're going to suffer from the fear and anxiety of possibly dying.
Thank you, Doctor. Thank you. We have very short time. We have lots of questions. One more interesting question, which I would like to ask. It's from the Facebook. What Western research have learned about Kundalini yoga, and does it have healing property for cancer patients?
So all yoga has healing property for cancer patients. Kundalini yoga has a very special interest for many people of Indian descent and in India. And that's because there's a whole body of literature on it. There are many people who practice what they call Kundalini yoga. I practice one style of Kundalini yoga. That's a very specific style of Kundalini yoga. It's more popular in the United States, South America, and Europe. It's not very popular in India. Kundalini yoga in our practice, in the style that I practice, is very similar to regular yoga practices. It is a very spiritual form of practice. There's a lot of mantra, there's a lot of meditation, there's a lot of chanting. There's a lot of focus on intrapersonal development. So it's a very spiritual form of yoga. I think that the more spiritual, more comprehensive styles of yoga are going to be more beneficial overall. And that applies to Kundalini yoga, it applies to other traditional yoga styles. So I think all yoga practices, and there's this whole concept of Kundalini in yoga, the idea that there's this energy that goes up and down the spine, and this is the energy of consciousness. I think all forms of yoga and meditation work on Kundalini in a positive way. So really there's not, I don't see this dramatic difference between what people are saying Kundalini yoga as opposed to regular yoga. This is just, it's all on a spectrum. And the Kundalini yoga that I practice falls on the spectrum of towards the more traditional spiritual types of yoga practice. We have a number of studies that have been done in the style of yoga that I practice. We have just over about 60 studies have been published on a variety of different types of things. We've looked at cognitive decline. My research has looked at insomnia and also anxiety disorders. We have a study on post-traumatic stress disorder. So there are a number of studies that we have looked at with style of yoga that I practice.
Okay, that's amazing. We have one more question. I think this will be the last. We have a lot more, but Nishia, if I'm spelling your name correct, Nishia, would you like to unmute yourself and ask your question?
Yes, thanks. Actually, the thing is that I have learned from research where they have said that regular practice of yoga can bring the changes to the epigenetic level. So is it possible that practicing yoga, we cannot help the bringing down the expression of genes to cause cancer? What is your view, sir?
So we have this very powerful field called molecular biology. And one of the subfields of that is to look at the activity of our genes, of our chromosomes. Now, we can't change those genes, but we can change their activity. And so the most obvious example of that, cancer related, if you smoke a lot of cigarettes, you are increasing the activity of genes that can produce a cancer tumor. If you do the opposite, if you engage in healthy behaviors, you get lots of exercise, you eat healthy foods, and don't smoke cigarettes, you will reduce the activity of those same genes. So by your behavior and by your diet, you can change the activity of specific genes. You can upregulate or increase the activity of some genes, and you can downregulate or decrease the activity of other genes. So we know this is true for diet, we know it's true for drugs. We also know now that it's true for meditative mind-body practices, that we can change gene expression. And the genes that are changing, the studies that have been done so far have shown that we can increase the activity of immune function genes, which results in improvements in immune function. We can reduce the activity of genes that are involved in stress and also in inflammation. Now, of course, as you start to improve immune function, that has direct impact for things like cancer, which is an invasive tumor. So yes, we are coming to the point where we can look at how our genes are behaving in response to these practices. And this will develop into a field of research where not only are we showing that the gross symptoms are improving, but we can see the changes at the genetic level as well. And it's no surprise, because if we are seeing changes in stress, it's not surprising that it's the genes that are making those changes in the stress response. So this is a field of research that's going to be very powerful, because it will be very objective evidence that we are making changes in yoga practice, not just at the gross level, but at the deep level of our functioning, down to our genetic makeup.
Thank you, Dr. Khalsa. There are a lot more questions, but we will have to end this session because we are already running over time. But thank you so much. It was amazing session, very, very informative. And it was wonderful to have you. Hope to see you again in more conferences like this. And thank you. Thanks a lot.
It was a pleasure to be here. Namaste.
Thank you
Yeah.
very much,
Thanks a lot, doctor. So much.